Hello, this is Dr. Eldred Taylor, and I'm here with Dr. Nathan Goodyear, who will be one of our speakers at our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November 10th through the 12th, 2016. Dr. Nathan Goodyear is the founder, co-owner, and lead physician at Seasons Wellness in Farragut, Tennessee. His passion for wellness began with his own 100-pound post-football career weight loss. Dr. Goodyear is dedicated to offering the latest advancements in wellness medicine with the most holistic approach to treatment possible. Dr. Goodyear is the author of Man Boob Nation, an integrative model to low testosterone, and he has spoken at numerous conferences and symposiums across the country. Dr. Goodyear will be speaking on physician burnout. Dr. Goodyear, that is a topic that's near and dear to a lot of our attendees' hearts, I'm sure. These are very trying times for doctors, especially in functional medicine with all the changes going on in healthcare with Obamacare. So, what do you have to share with us about physician burnout?
Well, basically for me, it's firsthand experience. You got to know where I came from, and I know where you came from, and it's been something that you've battled with and talked about. Maybe not in the terms calling it physician burnout, but that's what you've been battling, because physicians have been looking for an alternative means to simply be a physician, simply take care of their patients, and you've been on the front lines of that for years. And basically, for me, it was a firsthand tread through the sludge, I guess it would be, of combating a system that is just not set up for a patient and a doctor to work together. So my experience has driven my research into this, and then you know me, I got a big mouth, and if research indicates something needs to be told, I'm gonna go out there and I'm gonna say it.
Yeah. So what have you found? I see the Medscape and medical economics articles about physician burnout and physician pay. So what have you found? Is this a growing trend, or is this just a local phenomena? Is it a national phenomena? What's going on?
That's a great question, and I think it's a question that's not answered. It was the word physician burnout, or the term physician burnout, was actually first described in 1960, actually in a book describing a physician working in a leper colony. So that's actually the first descriptive term, physician burnout, that it's used. However, since that time, we've had massive amounts of research. And what that research has done over the 50 plus years is simply given us a lot of statistics, a working definition of physician burnout, and a better ability to recognize the signs and symptoms of physician burnout. Yet, when you actually look at the statistics of physician burnout, it's on a significant upward trend. 2001, the number of physicians with physician burnout was 22%. In 2015, it was upwards of 60%. And what's interesting about that, it's not just that these physicians were identifying with physician burnout, it's actually that the symptoms of physician burnout were actually more severe. So we're not only seeing an increasing trend of the number of physicians with burnout, but we're seeing an increase in severity of symptoms associated with it over the same time frame, where we just get nothing but research and statistics. And so the point is, the research and statistics that we've gotten over the last 50 years, it's not doing anything to get at the root cause of the problem, which is really interesting, because that's what drove you first and then me to look for a change in medicine, because we felt like we weren't treating our patients at the root cause. And I think you're seeing a same symptom in how physician burnout's being managed that you see in how we try to manage our patients in functional medicine.
And with any type of burnout, what we see with our patients, they become less effective at their jobs. They're less effective at their home. They're less effective in their communities. And I think that's what's happening with physicians. Physicians used to be at the forefront of their communities or whatever, but doctors are working so long and so hard, they don't have anything left for anybody else.
Yeah, they're simply trying to survive.
Yeah.
But when you look at physician burnout, clearly we are focused on the impact on physician, which is huge. talking about early physician drop out of the workforce.
Mm,
A Canadian study found $213 million system hit in dollars because of a loss of workload of physicians. Uh, Physician suicide is obviously a big concern, but equally, you're seeing a huge impact on patients. I mean, increased patient harm, increased patient litigation, which all of that's going to turn right around
yeah,
and impact the physician.
right.
So, it's both sides, but it's been how it's been evaluated and addressed over the last 50 plus years that I think is just it's perpetuated the problem. And just like in functional medicine, you're just going to continue to see a symptom-based approach of therapy to it, as you do in basically traditional medicine that functional medicine has been and will continue to battle.
Yeah. Yeah. Well, it's that's an interesting subject, and I think somebody does need to put all of those statistics together, and somebody in the healthcare administration needs to see what is happening and try to help change the system. It's just so hard to change this big, huge system. And then with Obamacare coming in and changing the system again, it's just it's tough. It's tough out there. So hopefully this information, maybe packaging it, will help someone pay attention to it more and see, try to come up with some strategies to try and fight it. Because I hear it all the time from the doctors I communicate with. It's getting tough, and doctors are leaving the workforce.
Yeah, and you're right. I mean, you hit the nail on the head there with talking about the systems, because actually the system is, I believe, one of the key underlying factors in physician burnout. Even going back to physician education, medical school, residency, etc. It is a major, major driving force in physician burnout. And until we accept the fact and recognize that that is a part of the problem, we're dealing with a paradigm problem. There was a great author, Buckminster Fuller, who said, in order to change an existing paradigm, you do not struggle to try and change the problematic model. Okay, our current medicine model is the problematic model.
Hmm.
But he said, create a new model and you make the old one obsolete.
Yeah.
And that's exactly what the AFMA and many other organizations work to do. They're trying to create a new model. You
Yeah.
can't work within the old model. The old model's broken.
Yeah.
You got to be able to recognize that the boat is the ship is sinking, and say,
Yeah.
you know what, I need to get out.
Right. It's just, I always say how to change the standard of care is what are most reasonable physicians doing in your area. We've got to get reasonable physicians to do reasonable things, and that's how you change the standard of care. It's not really by uh, having huge studies or laws or whatever. Just doctors need to start taking care of patients again, and the standard of care will change. But Dr. Goodyear, we'll sit here and talk. Dr. Goodyear and I are good friends. We'll sit here and talk for an hour, just
Yeah,
about medicine and all the things that we've both been through. So we're supposed to be just enticing the attendees to come. So I'm sure, again, most of the time people will switch to this type of medicine because they're so burnt out by conventional medicine. Or the other thing that happens is that the doctor will have a personal experience, either themselves or their family member, where conventional medicine didn't work, and then they've tried something else and have seen that it has solved the problem that conventional medicine couldn't solve. So a lot of times, physician burnout is the reason why they look for different ways to practice. So I think this is just an excellent topic to have. I think it's going to ring true for a lot of physicians and just healthcare practitioners, any type of healthcare practitioner that may come to our meeting in November. So Dr. Goodyear, it's always great to talk to you. We're kind of brothers from a different mother kind of thing. So anyway, so thanks so lot, thanks so much, Dr. Goodyear, and we always enjoy having you at our meetings. We always enjoy hearing you, and we also always get great reviews when you come and speak to us. So anybody who's thinking to come, you want to make sure that you stay and listen to Dr. Goodyear, and we can all talk about how we can change that problematic model. Any other parting words, Dr. Goodyear?
No, that's it. Because if I keep going, I could just I could keep
I
talking,
know, I
Mr. Taylor.
know. Okay, so again, thanks so much for your time this afternoon, and we look forward to seeing you in November if we don't see each other before. All right?
That sounds great, Dr. Taylor.
All right, great. Good afternoon. All right, bye bye.
Bye now.